Hi viewers, today we are going to discuss about PMJAY. This is one of the important national scheme. My name is K. Priyadarshini, working as a lecturer in Madras Medical Mission College of Nursing. The objective of this video define what is PMJAY, enlist the various benefits of the scheme and explain the categories and the service provided in the scheme. See, this PMJAY stands for Pradhan Mantri Jan Arogya Yojana. Okay, in this Ayushman Bharat is a flagship scheme of Government of India. It was launched in 2017 by our National Health Policy. Why they have introduced this Ayushman Bharat scheme? To achieve the vision of universal health coverage. We all know one of our country vision is universal health coverage. For achieving that thing, they have introduced the scheme. This initiative has been designed to meet the sustainable developmental goal, and it has underlying commitment, which is to leave no one behind. Mainly for that purpose, they have introduced this scheme. Introduction. Ayushman Bharat is an attempt to move from the sectoral and segmental approach of healthcare delivery to comprehensive need-based healthcare services. Okay, it's an attempt to move from the sectoral approach to comprehensive need-based healthcare services. This aims to undertake the path-breaking intervention to holistically address the healthcare system at various levels, primary, secondary and tertiary level. It adopts a continuum of care approach comprising of two interrelated components. The first component is Health and Wellness Center. The second one is Pradhan Mantri Jan Arogya Yojana. The first component is Health and Wellness Center. Okay. In February 2018, the Government of India announced the creation of 1,50,000 Health and Wellness Center by transforming the existing sub-center to the primary healthcare center. By this way, they have created 1,50,000 Health and Wellness Center. Okay. This center especially to deliver the comprehensive primary healthcare services, so that it bringing the healthcare closer to the homes of the people. So they cover both maternal and child healthcare services as well as non-communicable diseases, including free essential drugs and diagnostic services. This health and wellness centers mainly to deliver an expanded range of services and to address the primary healthcare needs of the entire population in the area, expanding the accessibility, universality of the services, equity. So everybody getting the equal amount of services and delivering the services very close to the community. The emphasis of health promotion and prevention is designed to bring focus on keeping the people healthy by engaging and empowering the individual and community to choose the healthy behavior and make changes that reduce the risk of developing the chronic diseases and the morbidity. So the main purpose is providing the universal services, equal services and easy accessible services to the community people, and engaging the individual and the community people, empowering the community people. These are all the main core elements of this Health and Wellness Center. Okay, first component we have seen, that is Health and Wellness Center. The second component is Pradhan Mantri Jan Arogya Yojana, PMJAY, PMJ. Okay, so this only popularly known as Arogya Yojana. Okay, this scheme was launched on 23rd September 2018 in Ranchi, Jharkhand by our Honorable Prime Minister of India, Sri Narendra Modi. This Ayushman Bharat is the largest health assurance scheme in the world. It aims at providing the health cover of rupees 5 lakh per family per year for the secondary and tertiary care hospitalization. Okay, and it covers nearly 12 crores poor and vulnerable families. If you take beneficiary counts, it approximately covers 55 crore beneficiaries that form the bottom 40% of the Indian population. So this is the huge health assurance insurance scheme in the world. The household includes or based on the deprivation and occupational criteria of socio-economical caste census 2011 for rural and urban areas respectively. And this Arogya Yojana is fully funded by the government, and cost of implementation is shared between the central and state government. Key features of Pradhan Mantri Jan Arogya Yojana. This is the world largest health insurance or assurance scheme fully financed by the government. Okay, and it provides a cover of 5 lakhs rupees per family per year for the secondary and tertiary care hospitalization. Okay, and across the public and private empaneled hospital in India. Over 12 crore poor and vulnerable entitled family, approximately I told that no, 55 crore beneficiaries are eligible for this benefits. And this provide cashless access to the healthcare services for the beneficiary at the point of service. And the envisions to help to mitigate the catastrophic expenditure on medical treatment, and this only pushes nearly 6 crore Indians into the poverty every year. It covers up to 3 days of pre-hospitalization and 15 days of post-hospitalization expenses such as diagnostics and medicines. Continuation of key features. There is no restriction on the family size, age or gender. All pre-existing conditions are covered from day one. Benefits of the scheme are portable across the country. Beneficiary can visit an empaneled public and private hospital in India, and they can avail the cashless treatment. Services include approximately 1,929 procedures covering all the cost and related to the treatment, including but not limited to the drugs, supplies, diagnostic services, physician fees, room charges, surgeon charges, OT and ICU charges, etc. Categories of beneficiaries. The following are the categories of beneficiary in both urban and rural region. See, the first one is families living in a kucha roof and wall house with only one room. Okay, and second one, the family with no adult member aged between 16 to 59 years, and families headed by the females, no male health members aged between 16 to 59 years, and SC/ST families, households with disabled members and no abled adult members, families that do not own any land and earn through the labor intensive jobs. These are all the categories under the PMJAY scheme. This is the logo of Pradhan Mantri Jan Arogya Yojana scheme. Ayushman comes under Ayushman Bharat. Implementation and scheme structure of Pradhan Mantri Jan Arogya Yojana. This was implemented through a collaborative effect between the central and the state government. The scheme operates on a robust framework encompassing various stakeholders, processes, ensuring smooth administration and efficient service delivery. The key component of the implementation and the scheme structure include central government role. First one is central government role. The central government is crucial in providing policy, guidance, overall coordination, financial support for the scheme. It established the overarching framework, set the broad guidelines, standards, and ensures the availability of necessary resources for the scheme's effective implementation. We have seen central government role, and the second one is state government role. The state government plays a significant part in the implementation of the scheme. They are responsible for identifying eligible beneficiaries from the category database and facilitating enrollment, issuance of e-cards, empanelment of the hospital and healthcare providers, monitoring the service delivery. State level coordination committee facilitate the effective communication and coordination between the various stakeholders, ensuring the seamless functioning of the scheme at the grassroots level. Third one is empanelment of hospital. Okay, this scheme follows a rigorous process of empaneling the hospital and healthcare providers. Empanelment ensures the beneficiaries receive the quality healthcare services from the accredited institution. The process involves evaluating the hospital based on the specific criteria such as infrastructure, quality of care, what they are providing in that centers, human resources, whether they are having adequate human resources, and adherence to the standard treatment protocol or not. This and all they are cross-checking, then only they are empaneling the hospital in the scheme. Empaneled hospitals agree to provide services at the predefined package rates, thereby maintaining the transparency and the affordability. Registration process. How they are doing the registration process. The registration process of the scheme is designed to be user-friendly and accessible, ensuring that eligible beneficiaries can avail themselves of the scheme benefits without undue complexity. Okay, and the following steps outline of registration process are: the first one is identification of eligible beneficiaries. How they are identifying? The state government utilize the socio-economic caste census database. Okay, socio-economic caste census database to identify the eligible beneficiary based on the predefined deprivation criteria. The database helps identify households that fall within the targeted socio-economic categories. The second step of registration process is verification and enrollment. Once the eligible beneficiaries are identified, they are required to provide the important document and information to support the eligibility. This include identification proof, income certificates, and other relevant document. The verification process ensures that only eligible individual and family are enrolled in the scheme. The third step is issuance of e-card for this Pradhan Mantri Jan Arogya Yojana. Upon successful verification and enrollment, eligible beneficiaries receive e-card. This card serves as a proof of their enrollment in the scheme and allow them to access the healthcare services at empaneled hospital. Next, we are going to discuss coverage and services provided under the scheme. Okay, first one, hospitalization. This covers expenses related to hospitalization, including room charges, diagnostic, surgery, medications. Okay, it covers extends to both planned hospitalization and emergency treatment, providing financial security during medical emergency. Second one is pre and post hospitalization card. This scheme also covered pre-hospitalization and post-hospitalization expenses. This includes consultation, diagnostic, medication, follow-up care associated with the treatment received during hospitalization. The pre and post-hospitalization care coverage period ensures the continuity of the care and support the overall recovery process. Third, daycare procedures. This covers specified daycare procedures also that do not require the overnight hospitalization but still necessitate specialized medical intervention. This ensures that beneficiaries have access to necessary treatment without any extended hospital stay. The fourth thing is maternity and newborn care. This provides coverage for maternity and newborn care, including prenatal consultation, antenatal care, delivery, postnatal care, newborn vaccination. This coverage aims to promote safe motherhood and well-being of the newborn. Pre-existing conditions. Unlike many health insurance schemes, this scheme also covers the pre-existing conditions. This ensures that individuals with pre-existing elements can avail themselves of necessary treatment and interventions without facing exclusion or additional financial burden. This scheme covers eye-cast treatment also. It covers specific eye-cast treatment including cancer, cardiac intervention, organ transplant, orthopedic procedures, etc. The inclusion of this treatment ensures that beneficiaries have access to the critical healthcare intervention that would otherwise be financially unattainable. So it covers various services like pre-hospital and post-hospital services, MCS services, emergency services, daycare services, as well as high-cost services also. The impact of Pradhan Mantri Jan Arogya Yojana. This gives financial protection and poverty alleviation and improved healthcare infrastructure. Employment generation, because of the so many people got employment. Future of Pradhan Mantri Jan Arogya Yojana. Pradhan Mantri Jan Arogya Yojana has already achieved remarkable milestones in improving the India's healthcare access and financial protection. However, the scheme continues to evolve and expand to further enhance its impact. The future of the scheme entails the following. First one, extended coverage and inclusion. The government aims to extend the coverage of the scheme to include more vulnerable population currently not within the scheme ambit. This expansion will ensure that broader section of society benefit from the scheme and get financial protection and healthcare access. Second thing is strengthening the primary healthcare services, and we recognize that importance of primary healthcare in promoting preventive care, early detection, comprehensive healthcare services while delivering the scheme. So the government is focusing on strengthening the primary healthcare infrastructure and ensuring the effective functioning of health and wellness centers. So this will complement the secondary and tertiary care provision of Pradhan Mantri Jan Arogya Yojana. Third one, technological advancement. Technology plays a crucial role in the implementation and administration of the scheme. So the government aims to leverage the technological advancement further to streamline the processes, improve the data management, enhance the overall efficiency of the scheme. Innovations like telemedicine, electronic health record, and digital payment system, this and all will facilitate the smoother service delivery. Conclusion. Pradhan Mantri Jan Arogya Yojana stands as a transformative healthcare scheme that was revolutionized healthcare access and financial protection to all over the population in India. And it positively impacted the life of millions of economically disadvantaged individuals and families through its comprehensive coverage, cashless access, and focus on quality healthcare services. With this continued commitment, the government and the stakeholders, the PMJAY scheme is poised to usher in a new era of equitable and affordable healthcare to all the people of our country. Thank you, viewers, for your support.